Hi, my name is Komal. This is my video submission for my case study 1. I will be doing a 360 room tour. So, well, TV. That's gonna be my patient, another wall, and my fourth wall. Okay. All right. Hey.
Come in.
Hi, how are you?
I'm good. How about you?
I'm great. So let me just start off with some hand hygiene. Get some sanitizer going. And I'm also just going to be sanitizing my stethoscope and my pen light. So just give me 1 second. And I will just be donning on some gloves. Alright, so hi, my name is Komal Modi. I'm going to be your student nurse today. I will be performing a physical assessment on you. The regions of your face that I will be touching will be your face, head, and neck. Is that okay?
Yep.
Okay, good. Before we start, would you like to get more comfortable? Would you like to use a bathroom?
No, I'm good. Thank you.
No? Okay, I'm just going to provide some privacy. And just before I begin, I just wanted to ask, what concerns brought you to the clinic today?
So I've been noticing that I've been having itchy and watery eyes. On top of that, I have a rash on my skin and my neck. And then on top of that, I feel really, really tired and I have a throbbing headache.
Okay, just another question, a few questions. So, can you give me an estimate timeline as to when your rash started to occur?
A couple of days.
Okay, do you have any previous allergies?
Nope.
Have you made any lifestyle changes? Like, have you traveled anywhere recently? Have you incorporated a new food item or diet or
No.
any type of substance? No?
No.
Have you, do you have any family history regarding like skin rashes on the face, neck, or other areas of the body?
No.
In terms of your watery eyes and your the itchy and watery eyes that you're getting, does that occur around the same time as your headaches and your fatigue?
No.
Okay, so I'm just gonna go ahead and begin the general survey. So the physical assessment, the patient seems to be, appears to be 18 years of age. There's an even fair skin tone complexion with an obvious sign of a rash on her face and her neck. There's no signs of body odor, which does indicate that the patient has good hygiene. In terms of the body structure, the patient is approximately 5'2" in height. The body shape is symmetrical. There is no signs of physical and obvious deformities, and the patient is slightly slouched, but that's normal. In terms of the mood, the patient is wearing a slight weary face. There is no slight weary face. The mood is low and fatigue. The patient is able to fully articulate sentences and speeches, so there's no concern with speech. And the patient is wearing appropriate clothing for the weather, and there is no, and is also in fresh clothes. And the patient is also engaging in strong eye contact while conversing with me. So in terms of your mobility, can you just get up and walk back and forth for me?
Yep.
Great, thank you so much. So the patient does demonstrate a strong walk and stability. So there's no signs or concerns with gait. In terms of the LOC, I'm just going to be asking you a couple of questions. But before I do, I just also wanted to point out that you're breathing. There's no signs or distress in your breathing. There's no signs of labored in your breathing. And your breathing seems to be normal flow, smooth, and you are getting, and it's performing well. So now I'm in terms of assessing your LOC, I'm just going to be asking a couple of questions. So can you just give me your name, date of birth, and age?
So Sarah Mills, my birthday is September 16, 2003. I am 18 years old.
Okay, and do you know where we are, Sarah?
Yeah, we're in the clinic.
Okay, and do you know what day and time it is?
So today's June 17th, 2021, and it's 5:30 p.m.
Okay, thank you so much. So the patient is demonstrating strong alertness and is orientated to the person, place, and time. The speech is also well and normal. So Sarah, I'm gonna go ahead and start doing palpation and inspection of your head. So just relax. Okay, so the patient is showing no obvious physical deformities. There's no signs of lesions, bumps, bruises, or bumps, lesions, bruises, and lumps. Do you feel any pain when I touch you here?
Nope.
Okay, so during palpation, the patient feels no pain. So I'm just gonna go ahead and assess your hair and facial structures. So in terms of your hair, you have thick, long black hair. It's also evenly distributed. The texture of your hair is wavy and soft texture. There's no signs of dryness. There's no signs of infestation such as lice. There's also no signs of foreign bodies. In terms of your facial structure, there's no signs of irregular facial structures or movements. The patient has a symmetrical shape from the eyebrows, eyes, and cheeks. The patient shows no visual signs of lesions or masses on their face. There's also no signs of hyperpigmentation and scars. However, the patient does show some minimal signs of redness and inflammation from the rash on the face and the neck. And there is also and Sarah, when I touch you here, do you feel any pain?
No.
And do you and there's no signs of abnormal temperature. Okay, so I will now begin to assess your cranial nerve 7, which is also known as your facial nerves. So, Sarah, can you just smile for me? Good. Can you smile with teeth for me? Good. Can you raise your eyebrows for me? Good. Can you close your eyes tightly? Good. Can you frown for me? Good. And can you puff your cheeks out for me? Okay, so the patient is showing positive and successful signs of facial expressions, which does indicate that the cranial nerve 7 is intact. Okay, so in terms of your, I'm gonna go ahead and move on to your eyes. So the patient's eyes are symmetrical and aligned equally. The size and shape are roughly the same. There is a little bit of clear fluid drainage, which may also indicate from her watery eyes, symptoms from her watery eyes. And her eyelashes are also evenly distributed on both eyes. And I'm also, yeah. There's no signs of crusting and no unusual discharge, and there's also no signs of lid lag when the patient blinks. Okay, so Sarah, I'm gonna go ahead and assess your cranial nerve 3, which is also known as your ocular motors. So I'm just gonna grab my pen light and my light. So I'm just gonna measure your eyes. So just try to focus on me or the wall behind me. So the patient shows 5 millimeters in dilation, which is normal. I'm just going to shed a little bit of light on you. Okay. So the patient is showing 1 to 2 milliliters of constriction, which is also normal. Let me just look at me right here for a second. I'm also going to just take my pen light. So I just want you to focus on the light. Just fixate your eyes here, and I'm going to bring it closer towards you. Okay? All right, so the patient is showing successful signs in papillary constrictions and the convergence. So just to recap, the eyes also, I noticed that there's your sclera and your conjunctiva, they are slightly pinkish red. Slightly pinkish red, and your blood vessels are also dilated. Okay, so other than that, you are good in your eye assessments, and I'm gonna go ahead and start your lymph nodes. Okay, so let me just push your hair back if you don't mind.
Yep.
Right, sorry about that. So this is your preocular, your postocular, your occipital. This is your jugulo-digastric, which is also known as your tonsils. Can you just turn to right? Okay. This is your superficial cervical. This is your deep cervical. This is your posterior cervical. I'm just gonna feel it. Right. Good. Can you turn to the right? Yeah. Okay. And then this is going to be your submandibular, submental, and this is your supraclavicular. All right, Sarah, you did a great job. Thank you so much. And this concludes to my physical assessment of my face, neck, and head of my patient, Sarah. Thank you so much, and